Hey everyone, and hello to my online friends. My name is Ren, and this is Jess. I'm going to be doing a lot of the talking today because Jess is recovering from illness. But Jess was super influential and super important in this whole process. She's been my partner since day one. So, don't think that just because I'm doing the talking, I did all the work. That is not true. So, just wanted to make that very clear. Okay, so now that that's out of the way, I'm just starting a little timer here so I stay on track. Jess and I partnered with the Alzheimer's Association, specifically with Janie. Thank you, Janie. And we kind of got ourselves really involved with advocacy with them. Awesome. So for our Hartford project, we spent a day volunteering with the Alzheimer's Association, which was absolutely great. But before we were allowed to jump into the community, we had to kind of spend some hours training. Makes sense. So what did our training look like? Okay, so the Alzheimer's onboarding volunteer training program prepared us to serve the community in meaningful ways. Through this program, we trained as both community educators, delivering prepared presentations on Alzheimer's disease and other dementias, and community representatives, raising awareness, sharing basic information, and connecting with individuals who are needing services. Together, these roles help support the organization's mission by educating the public and guiding communities to vital resources. The overall training process, it took a few weeks. It included several components like background checks, a bunch of online modules. A bunch of online modules kind of seen here, as well as some orientation sessions that we had with Janie, in which she kind of walked through the website with us, walked through the role of volunteers in her organization, how she works with volunteers, what's really expected of us. As well as we were given the opportunity to sit down and watch someone's presentation, kind of see how it's done firsthand. The training was super beneficial to us. It makes sense. The Alzheimer's Association wants people with the right message going out into the community, and through this training, we were better equipped to deliver that message. So before we continue, we do want to share some of the things we learned during training. So as I'm sure many of my cohort is aware, what is dementia? So broadly speaking, dementia is an umbrella term. It covers a wide range of conditions that affect memory, thinking, language, problem solving, personality. These changes are serious enough to interfere with daily life and independence. They don't just affect the person living with dementia, they affect their family members, their community, their loved ones. Alzheimer's disease is the most common cause of dementia. It's accounting for 60 to 80% of cases, but it is not the only one. Vascular dementia can result from tiny strokes or blood vessel blockages in the brain. Some experience mixed dementia, where more than one type of change is happening at the same time. There are other conditions like thyroid issues or vitamin deficiencies that can cause dementia-like symptoms, but are actually treatable and reversible. But understanding long story short, understanding the difference matters. Diagnosis early matters. Some more dementia facts and figures. So these kind of numbers are overwhelming because behind every statistic is a real person, a real family, and a real story. Over 7 million Americans are living with Alzheimer's today. That's 7 million lives forever changed, not including their family and friends. Nearly 12 million people, spouses, children, friends, are providing care. Not for a paycheck, but out of care. They give their time, their energy, and often their own health and well-being. Alzheimer's isn't just a disease of memory, it's a disease that steals futures. It's one of the most expensive conditions in our society, draining families emotionally and financially. If we don't act, the toll will only continue to grow on our healthcare system and communities. So here's some healthy brain habits. Talking a lot about scary statistics, but there are things that you can do to help prevent or delay the onset of Alzheimer's itself. So long story short, what's good for the heart is good for the brain. Get moving, try not to smoke, control your blood pressure, sleep well. Sleep is huge. Sleep, it's great. But also keeping your brain active, doing things like crossword puzzles and protecting your skull when you're going out on a bike. These kinds of things, if you can protect your brain and protect your heart, you can delay your onset or potentially prevent Alzheimer's. Okay, so I've been talking at you guys a lot about all these super fun and awesome facts about Alzheimer's. But what did Jess and I actually do? Okay, so after a bunch of training and a bunch of clearances, we were able to go out into the community. So on Saturday, March 7th, Jess and I volunteered to table for the Alzheimer's Association at the Convention Center in downtown Pittsburgh. During our 6-hour shift, we engaged with a diverse group of people ranging from little kids to older adults. We passed out over 100 purple ribbons that you can see Jess and I wearing now. And we shared moments of understanding, acknowledging the grief and loss that those who had experienced dementia had gone through. Regardless of anyone's connection to dementia, they did want to talk about it. We spoke with caregivers, we spoke with people who were affected, we spoke with loved ones. Everyone had a connection to Alzheimer's and everyone wanted a space to talk about it. Through our timetabling, we learned a lot about community perception and reactions to Alzheimer's. Some individuals would actively avoid eye contact and walk really fast in the opposite direction when we saw them. Makes sense. Alzheimer's is a scary thing to talk about, and it kind of bums you out if you're just there to walk around a convention center. I get it. I don't take it personally. And like I said, other individuals were eager to discuss the topic. People would come up to us, open a basic dialogue of, hey, how you doing? And then dive into their story, their connection, and their experience with Alzheimer's. Regardless to their connection to Alzheimer's, everyone who stopped by our table was enthusiastic to learn more of prevention, just like the 10 healthy habits that I had spoken about earlier. Something that I feel like is an important thing to highlight here, for caregivers, the 24/7 helpline was super awesome. A lot of caregivers who stopped by our table were super excited to hear about this. For those of you who don't know, the Alzheimer's Association has a 24/7 helpline. This number you can call if you're looking for resources, looking for a little bit of help, if you're just stuck. It kind of gives caregivers a jumping off point. Being a caregiver is difficult work, something I'm sure a lot of you are aware of. So this 24-hour helpline gives people a jumping off point, and it gives them a little bit of support in a role that is often unthanked. Before we finish, I would also love to highlight the Walk to End Alzheimer's. A few of us participated in this last year. It was great, but it's an excellent opportunity to spread awareness and raise money. So any of you who are currently in Pittsburgh or who are staying in Pittsburgh and will be here in October, it's a great way to go outside, students. It's an awesome way to touch grass. That's how I got out last semester. But it is a really great opportunity to advocate for Alzheimer's and really spread the message. It's held annually in more than 600 communities nationwide. So for those of you online who are not in Pittsburgh, go to the Alzheimer's Association website and look up a walk near you. I'm sure it's also a great way to touch grass for you guys. So before we finish, special thanks to Janie. Literally, we couldn't have done any of this without you. You connected us with resources, you got us trained, and you were there to support us at every step. Additionally, I'd love to thank the baby goats. Baby goats were at the conference. Baby goats were awesome. Big fan of the baby goats. All right. Hey everyone, here Dean Farmer asked how we can include baby goats as an intervention for those with Alzheimer's. So in my experience as someone who's been working with Alzheimer's patients for 6 years now, animal interventions like animal therapies are great for people with Alzheimer's. While I haven't seen it implemented via baby goat, I have seen it with dogs and typical house pet therapies. So at an internship I was at a couple of years ago, there were volunteers who had emotional support dogs, and they would go into these nursing homes and walk around, and everyone loves a dog. A lot of people love dogs. And it was a great way for some of these patients who were agitated, might not be able to communicate their feelings, to, for a couple of minutes, just sit and relax with a dog. So, hey, maybe baby goats would work too.
Part of advocacy, you've had this advocacy experience. Uh, what role has it played in your own personal lives, having had this experience?
Yeah, I appreciate that. So, I think it was super helpful. Learning specifically some of the more facts and figures that you can kind of communicate when you're going through advocacy. So before my work with the Alzheimer's Association, my advocacy kind of started and ended with my own experience with family and friends. And don't get me wrong, those are great stories to share. But also knowing some of the facts and figures and being able to engage in not just a personal conversation, but like a proactive one of being able to tell my story, but also engage with here are the things that you can do to prevent it. Here are the things that you can do to, like keep your brain healthy. It was a more proactive approach as opposed to a reactive kind of just building connections kind of thing.
Jessica, do you want to say what?
I think the 800 number was the biggest impact because as caregivers, we burn out so quickly, so easily. We're alone. We feel so alone, excuse me. And so knowing that the Alzheimer's Association has a 24/7 number, that was my main lead to getting people involved. Like, hey, you may know somebody, you may know a neighbor, but here's a number in case you need something. And that changed like so many impact on it. Like, huge difference just because it can be a simple question. What can I do for so and so? So and so is doing this. Call this number, they can answer it, and they are professionals who know what they're doing. So
Part of
Prior to this role, you were aware of Alzheimer's. And so what was the most surprising thing that you learned from advocating and having this condition?
Yeah. Do you want to go first?
the amount of people who do not want to talk about it.
Yeah.
I was not prepared for so many people to turn us down. They don't want to talk about it. They're scared. And it's older people. And I wasn't prepared for them to just turn us away. So.
Yeah, no, the still words right out of my mouth, exact same. The amount of people who would see us smiling, trying to engage, and then see the sign behind us, and then who would, avert their eyes and walk away. Very surprising, not something that I had experienced before in other types of advocacy work that I've done. So yeah, no, very surprising. My experience as someone who's been working with Alzheimer's patients for 6 years now, animal interventions like animal therapies are great for people with Alzheimer's. While I haven't seen it implemented via baby goat, I have seen it with dogs and typical house pet therapies. So at an internship I was at a couple of years ago, there were volunteers who had unusual sport dogs, and they would go into these nursing homes and walk around, and everyone loves a dog. A lot of people love dogs. And it was a great way for some of these patients who were agitated, might not be able to communicate their feelings, to, for a couple of minutes, just sit and relax with the dog. So, hey, maybe baby goes to work too. Any other questions?
Dr. Engel has a question online.
Hi, can you hear me?
Yes. Okay.
Thank you. I also have a cold, so I apologize. I'm curious. So, part of advocacy, you've had this advocacy experience. What role has it played in your own personal lives, having had this experience?
Yeah, I appreciate that. So, I think it was super helpful. Learning specifically some of the more facts and figures that you can kind of communicate when you're going through advocacy. So before my work with the Alzheimer's Association, my advocacy kind of started and ended with my own experience with family and friends. And don't get me wrong, those are great stories to share. But also knowing some of the facts and figures and being able to engage in not just a personal conversation, but like a proactive one of being able to tell my story, but also engage with here are the things that you can do to prevent it. Here are the things that you can do to, keep your brain healthy. It was a more proactive approach as opposed to a reactive kind of just building connections kind of thing.
Jessica, do you want to say what?
I think the 800 number was the biggest impact because as caregivers, we burn out so quickly, so easily. We're alone. We feel so alone, excuse me. And so knowing that the Alzheimer's Association has a 24/7 number, that was my main lead to getting people involved. Like, hey, you may know somebody, you may know a neighbor, but here's a number in case you need something. And that changed like so many impact on it. Like,
Yeah.
huge difference, just because it can be a simple question. What can I do for so-and-so? So-and-so's doing this. Call this number. They can answer it, and they are professionals who know what they're doing. So.
We might have sort of answered this.
No worries.
So I'm assuming prior to this role, you were aware of Alzheimer's. And so what was the most surprising thing that you learned from advocating and having this condition?
Yeah. Do you want to go first?
The amount of people who do not want to talk about it.
Yeah.
I was not prepared for so many people to turn us down. They don't want to talk about it. They're scared. And it's older people. And I wasn't prepared for them to just turn us away. So.
Yeah, no, the still words right out of my mouth, exact same. The amount of people who would see us smiling, trying to engage, and then see the sign behind us, and then who would, avert their eyes and walk away. Very surprising, not something that I had experienced before in other types of advocacy work that I've done. So yeah, no, very surprising.
We're talking about GIFT, and specifically GIFT's Senior to Senior program, which the overarching topic is wellness in older adults and intergenerational interactions and the impact of that. So GIFT, you can kind of see the little infographic there. It stands for Giving It Forward Together. GIFT is based in Pittsburgh, and it is a nonprofit aiming to create opportunities for intergenerational community volunteerism, and aims to bridge the gap between older adults and students, mostly college students. The S2S program in specific stands for Senior to Student. They're held at various senior high-rises in the county and are run by student ambassadors at GIFT, who are, like I said, primarily students at universities in Allegheny County. It aims to create a bond between seniors in the community and college students who are collaborating on various volunteer projects for different Pittsburgh-based nonprofits. And what we did with the GIFT and the Senior to Senior projects we were student ambassadors. We helped out with the projects, but we also made a survey and we're kind of trying to assess the benefit and the outcome of those intergenerational relationships.
So thanks. So we did a lit review to analyze kind of the research that's out there supporting this idea that intergenerational relationships are beneficial from both ends. And the literature was overwhelmingly supportive of GIFT and their mission and their impact that they have. It supported that the outcomes showed better attitudes about aging for both older adults and the younger generations. There was less feelings of isolation with older adults, less risk for chronic illness. The programs that were reported on were similar to GIFT, so we knew that the research coincided with what we were doing. And there were also benefits reported on building those intergenerational relationships and just, again, it just validated GIFT's mission and what we did in our programming.
Okay, so now on to our survey and how we developed it. Okay, so we went into this with the goal of evaluating the impact of intergenerational connection on the seniors who participate in the GIFT Senior to Student programming. And we decided to, like we've already mentioned, to focus on physical and emotional wellness in particular. So looking over the formerly used GIFT survey, It consisted of 10 Likert scaled questions, and the survey was a really good starting point for us. However, we noticed right away that questions were somewhat long. A few of them were repetitive in nature, and at times the language and wording was a little bit complicated. And this was relevant to us because in the first program that I attended, I noticed that a good chunk of the residents did not speak English as their first language. And so I wanted to kind of keep that in mind as we developed these questions so that it would be more accessible for those residents. And then second, we took these 10 Likert scaled questions, we evolved them into just 9, and we used direct and plain language with the participants in mind. And then additionally, we decided to add 2 short answer questions in order to offer the chance for more personalized responses and to give the opportunity for connection between the students and the seniors. And then, so at the second event that I attended, I really noticed that these last 2 short answer questions drew people's attention. The seniors definitely felt more compelled to interact with these questions, and you can see them up here. Yeah, they are small. One of the questions is, can you think of an example in your life when intergenerational connection positively affected your physical and emotional well-being? And then the second question was, what would you like to tell your 20-year-old self? So these questions definitely made the seniors engage with us a lot. And I think as a student, it was really meaningful to me to hear those responses.
Okay, so I will be going over the results of our survey. And so the first thing I really just wanted to touch on was the total number of surveys that we acquired, which was 8. And so I really want to go over some important factors that impacted this number. So the first one is the frequency of involvement. So basically what this means is that we saw a lot of the same people at specific locations for the gift events. So for example, the people who attended the event at One Riverview Towers, which is where I was placed. And so those were usually the people we would see at the second event for Review Towers. So I think this really shows that those who do participate with gifts were very loyal to the program. And then so the second thing is the number of participants at these events. So this really impacted the number of people we had at events. We usually saw, I want to say 5 to 7 participants for each event. And in fact, we even had an event that went off that we had no seniors join, but like, I kind of don't blame them. Sometimes the times are from like 6 to 7 or 7 to 8. So not the best times, but you know, we were working throughout the day, so we had to make it work. But yeah, I just wanted to show that there were times where we had a bunch of people, like our ice cream social had, oh my goodness, like 15 seniors. And then our scrapbooking, I think it was, that was no seniors, unfortunately. But even with the smaller sample size, the findings showed a really clear and consistent trend. So for this, I wanted to go over key findings. We found that 62.5% of participants strongly agreed that they feel better physically when engaging in social interactions with people from other generations. And additionally, 75% of participants strongly agreed that participating in intergenerational events helps decrease negative emotions like anxiety and loneliness. And lastly, we also found that 75% strongly agreed that these events increase their sense of agency and confidence. So the program isn't just reducing negative feelings, it's also helping participants feel more empowered and engaged. And we kind of came to like the overall conclusion based on that participants reported that meaningful intergenerational interactions improved both their physical and mental wellness, which really highlights the impact of the GIFTS Senior to Student program. So like I said, again, even with a small sample size, these findings can still be really useful for improving and strengthening the program in the future. So first, the results show that intergenerational interaction is clearly beneficial. So the program could focus on maintaining or expanding these opportunities to ensure that participants continue to experience these positive outcomes in the future as well. And second, since the participation levels affected how much data we could collect, this suggests that we need to increase engagement and attendance at events, maybe make the times a little bit better. I know we work with students in this case, but maybe we can schedule one for like an afternoon, a luncheon, something like that. And then lastly, these findings can be used to support funding and in advocacy efforts. This data clearly shows that there are benefits related to emotional well-being, confidence, and physical health, which are all important outcomes when demonstrating program effectiveness, of course. And then the last thing I would just like to point out around the slide is quotes from one of our questions. This was from the question, what would you tell your 20-year-old self? And so these are like 4 quotes I got. Be more confident. Life is not a race. Make a joke. And my personal favorite, you don't have to get married right away. Okay, and so next we'll be going over our experiences, our reflection. It'll be short and brief, but these are just some photos of us at the Gift Senior to Senior, and also like our gift and student ambassador night that we had. So we're all just going to touch on them briefly.
Okay, so I'll go first. So this experience provided me with a really unique opportunity to meet the older adults in our community in a really casual and fun setting. I was really fortunate to hear stories about life in Las Vegas, in the Los Angeles world of film, and different travels and musical performances that people had done. And I also learned that many older adults are not inclined to participate in surveys. So like Cassandra said, I do wonder if this was due to the fairly late times of our event. However, I think I can use this kind of in my professional career going forward, and to keep it in mind when I think of how to engage different communities. And then I also, like I had mentioned, when I was discussing the short answer questions with older adults, I noticed that that became a really meaningful experience, and a good way to connect with people who you don't know yet. So that was really interesting to me. And then overall, from GIFT and from my placement at Western Psych, I've just learned so many professional skills for gerontology. And I'm really, really grateful for this opportunity. So thank you all.
So yeah, GIFT has taught me so much about the importance of communication and connection with older adults, and also just like my peers as well. I love facilitating our senior to student events. That was probably my favorite part. Not only did it give me the opportunities to connect with seniors, but it also, a big part of GIFT is connecting with local nonprofits, which I got to do. And so I loved working with local nonprofits like Girls on the Run, the Humane Animal Rescue, and Sunny's Community Garden. I loved making crafts with everyone and just talking, connecting, learning about their lived experiences, sharing my lived experiences. I felt like we really had a good flow of conversation. And I truly think that this is something that is going to help me so much in my professional career, but it's also something that's going to stick with me in my personal life for so many years, probably forever. I got to meet so many nice people, and I loved working with everyone at Senior to Senior, at GIFT, and also here. So thank you so much.
It was really great to see how important this program is to the seniors, because these are folks who see this program every spring or every fall and spring, and they look forward to it. They look forward to interacting with college students. I got the opportunity, I'm not from Pittsburgh, so I got a lot of recommendations from older people from Pittsburgh on like where to go and what to do. And it was really great to see to understand how we engage with our community so similarly, yet the generational gap might be so large. So it was really great.
Some of my takeaways were the importance of not just intergenerational relationships, but between cultures, and kind of like the idea that people like to share information about their culture and teach other people. Like that photo there here is from a mock Seder that Cassandra and I attended. I forget if any of us mentioned that GIFT is like a Jewish organization, but I learned a lot there, and I was able to speak to a lot of different people and hear different stories that I might have not heard otherwise. And then definitely a big reflection was that food is really motivating to get people to show up to community gatherings. Like Cassandra said, the ice cream thing was extremely successful, and then the mock Seder, there was a lot of people there too, and it seemed like the common denominator was food. And then a last reflection was, when you're speaking to the older population, you do have to project, and I'm really bad at that. Today we are
Most of you in the audience and in the front of the room, the placements or the practicums where we have you working, you're working with people who are in very vulnerable states and who might be in the midst of illness or another pretty significant challenge. Did you have any takeaways about working with people who were living more independently or with supports, but in the community and not necessarily in a program that was about a problem?
So like I said, my practicum is with the Ombudsman program, which if you don't know, that's the Allegheny County's it's like an advocacy program for adults in long-term care. But one of the things that I was I guess partly was responsible for through my practicum was the PEER program, which stands for Pennsylvania Expert Empowered Residents, which is like the residents of the home who are like advocates for the Ombudsman program. But I think just like the importance of having like a community, a group of people who might be dealing with the same difficulties as you, or even just to like just having like I think a community interaction or social interactions, the importance of that, especially for adults who are increasingly experiencing more isolation as they aren't allowed to, or aren't able to be out in the world as much. I think it makes a whole bunch of difference.
Anyone else have a thought to that?
Yeah, I can add a little something. So at Western Psych, people are definitely in a very vulnerable position. And that's why I chose GIFT, because I wanted kind of to have like a really positive place to balance it out. But I think overall what I've learned is like we're all just people, and food and conversation will connect all of us. And then along with the food aspect, I have a certificate in Asian studies. And so I know that at least in many Asian cultures, food really brings people together. And it's really common to kind of share a table of food amongst a family or a group of friends as a social activity. And I think that's something that we can definitely keep in mind when working with different populations here in the US as well.
From observing the interactions between the generations, it's a double question. And what recommendations would you make to another organization interested in starting a similar program?
So I would say one of the biggest things that I observed is that we all love to talk. Like, it doesn't matter what age you are. Everyone just wants to have a conversation, be heard, and, feel that connection. I feel like in my conversations, like, I had so much to say. Like, I'm a big chatterbox, and being paired with another chatterbox, like, it was perfect. I got to say and I got to connect, and I love that about the senior to student events. And then just for starting this, a program like this in general, Rocco, the founder of GIFT, she always talks about how it was a really big struggle in the beginning. There's a lot of things that she had to worry about, funding, and how, stuff like her nationality and being Jewish really impacted that. And so she talks about the struggles, and I think what really you need for a project like this, that she always talks about, is passion. You need passion. You need, like every local nonprofit, you want to help, you want to make a difference. And for that, you need to be passionate, and you need to continue working no matter how many setbacks that you have. I think what really worked well for GIFT is working with retirement communities, but they're not retirement communities, like working in like senior high rises, basically. You go to them, not really having them go to you, and working with the building, setting up a date and a time where they can just go down to their like community room, and we can just meet them there and just have a good hour of the day to just focus on doing what you enjoy, focusing on creating a difference within the community with other local nonprofits. I think that's what made it so impactful, was that it was all connected throughout the community. So the seniors got to feel like they were making a difference, the students got to feel like they were making a difference, and I think that's what really drives a program like GIFT.
Talk to us about the cultural learnings. This is clearly a Jewish identifying organization, and so what are the things you learned? What are things that resonated, if that is part of your identity? And how did you think about what cultural humility and or competency looks like in coming into a space?
Sorry. Like I said before, like Emma said before, I've never been to a mock Seder before, so that was a very big new experience for me. And I just learning a Jewish tradition like that. Like I grew up Catholic, I grew up Christian, so it was I've honestly had no real experience with another religion, and so it was very educational. And not only that, I got to participate. Like I learned that you get to read, I think it's 11 questions, and then have a conversation about it. And after that, you get to eat, and I had food that I've never had before. And it just reminded me that I have to, like, it's always important to learn about other cultures, to learn about other people's lives, because this is something that is a part of their identity. And I want to be aware of, I want to know, hear about those struggles that they had because of their identity. Like, especially for me, like I would share my experience as a Hispanic woman, as a Latina, and they would share their experience as a Jewish woman. And it was just learning about people, learning how to communicate, learning what's respectful, what I shouldn't say, what they shouldn't say. Like it's a very open place. Like, you can make mistakes. It's understanding that you might say something that, oh wait, like I didn't mean it that way, but it's learning from that. It's coming back better, it's coming back stronger, and coming back more educated. But yeah, I really enjoyed the mock Seder. I would go to another one 100%. The food was great. The conversation was great. So yeah, I had a great time.
Yeah, I just wanted to quickly add about the Seder. I guess you can't see the photo. Yeah, like the photo there, you can kind of see it in the corner, but like the Haggadah, I believe it's called. I kind of looked through that too. I was able to like read some of that and learn that. And then at the Seder, the actual like event, I didn't know about what a Seder was, but like you ask 11 questions to the table and everyone answers, and they're all kind of like maybe not faith-based, but like personal belief based, and then you eat and then you answer like 4 more questions. And I didn't know anything about that before, and I feel like it was also kind of this is very universal, like again, kind of like what Zoe said, like just sitting around a table, eating, learning about each other, hearing each other's stories, and the importance that has with community, intergenerational connection.
Hi, I'm Janie from the Alzheimer's Association, and you heard from Jess and Ren earlier about some of the challenges in communicating about dementia. That's a topic that many people just want to run up to you and talk about. I know you were talking about in your experience through the GIFT program that was mostly social interaction, if I was understanding that correctly. One of the things that we're looking at the Alzheimer's Association is expanding our reach to different audiences. And often we're talking to older populations who don't want to hear from us because some of the feelings are, it's too late for me, I can't make differences in my life. And they were mentioning earlier when they were sharing their experience with us that brain health and risk reduction is something that we're trying to talk to all audiences, no matter where you are in your health journey or your age. Do you think through your experience, maybe some of what you took away from that experience with intergenerational could be applied to learning situations?
Absolutely. I think that similar to how we all want to provide for our communities in like these volunteer aspects that we were able to bring, education ties into that because it was also understanding what we were doing and how it was significant. And so I definitely think that education around like Alzheimer's, for example, could absolutely bridge intergenerational relationships.
Yes.
Okay, so Ren and Jess didn't know it, but they actually gave us a great introduction into our project. So they said people don't want to talk about Alzheimer's, and we're here partly because people don't want to talk about end-of-life planning, which is why our project was originally called You're Gonna Live Forever, Mom, because we don't want to talk about what the end of your life might look like. However, we decided that ultimately we wanted to have a broader scope. So it's always the right time to talk about either end-of-life planning or your wishes for your healthcare. It can be any time, any age, any health status. It's good to have thought about what you might want to share with someone who is a safe person, what you might want if you're not able to communicate to yourself or communicate your own wishes. So that ended up being the sort of broader scope we wanted to share about. It's always the right time.
All right, just to give a brief overview of what advanced care planning is, you might also see it as ACP. And it is the process of discussing and documenting future healthcare wishes. Again, I mean, anything could happen. You could get in a car accident. It's just good for people to know what you would want. And advanced care planning can include living wills, assigning a healthcare power of attorney, and a lot of goals of care discussion. It really focuses on autonomy, dignity, and making sure that people are making informed decisions. And it's a conversation that doesn't happen just once.
Okay, so what we put together to sort of serve the purpose of making an advanced care planning conversation more accessible we made a document, and it's actually there on our table. We forgot to pass them around. So Professor Mulvaney, if you want to share them, yes, we forgot to pass those around. Thank you so much. So we made the document that you're about to see. It is a toolkit. That's what we called it, is a toolkit to help sort of jumpstart the discussion around advanced care planning. We included, first of all, a lot of vocabulary. What do people mean when they say, are you DNR, DNI? What is a pulse? What's a living will? All of these things. So we included a lot of vocabulary to help get the conversation going. Then we also included example documents, for example, a pulse for people to look at, see the questions that are there. And then we also hosted a hybrid learning event this last week here in person and on Zoom to talk about advanced care planning and help provide some education on the process. We also included in our document the 2-page advanced care planning guide from our other Hartford group, who's going to present after us. And then after we hosted our event, we had a pre-survey, and then we had a post-survey to gauge whether our guests learned from what we taught them.
Including Professor Mulvaney, who kindly donated her time to help us give our hybrid presentation. We had, excluding Professor Mulvaney, one person attend in person who is a dental student, and then we had 7 folks attend the entire event on Zoom. One person had left sort of early in the meeting, and another person had joined at the end. So of the 8 people that attended the entire session, 3 students, 2 of whom were social workers, 1 was an occupational therapist, completed both our pre and post surveys. So I think what we're learning today is that people hate surveys and will use any excuse not to do them, which sucks because that's how we research. So the surveys were made up like the gift program. They were made up of a Likert scale. They were the same 9 questions, asking attendees to rate from strongly disagree to strongly agree their comfort and knowledge of advanced care directives, healthcare proxies, and their confidence about talking to clients and their own personal families about these topics. So it was like, I know what an advanced care planning, I know what that means. I have thought of making a living will. I know what a healthcare proxy is. So of the 3 students who completed it, all reported that they felt increased confidence in at least 3 of those statements we had. 1 person moved from not having thought about creating an advanced directive at all to considering writing one, which we consider a huge success. That's what we were trying to do. As part of our hybrid event, we had a breakout session for a role play where we asked our attendees to role play as either a healthcare provider and their client, or a family member resistant to advanced care planning with their loved one's provider, like the "you're gonna live forever mom" kind of idea. So we had one group with the in-person followed, and one group online followed the role play. Another group just had a general discussion about advanced care planning. It seemed like the groups that did do the role play really enjoyed it. If we were to do this presentation again, I'd make sure that all attendees understood the role play prompts before breaking into groups. That was my bad for not making sure everyone knew the purpose of the breakout group. So we received really gracious feedback from those who completed our surveys, even from folks who didn't complete the pre-presentation survey. Our favorite feedback was the following from a fellow social work student. Thank you for giving us so much time for the breakouts. I attended with my partner as we're both in our 40s and have aging parents, so the topic is timely for us. We had a great conversation. I also picked up some language from you that I can deploy with my clients if needed. So that was huge. We're like, oh my God, we did it. Yay. Excluding Professor.
All right, so some key takeaways from our project. We learned how to break down complex medical information and present it in a way that's accessible and clear to a general audience. I feel that it also strengthened our research skills. We had to do a lot of research and pull it together, so that was good. We also did develop hands-on experience creating educational material and presenting to an audience. And again, the feedback we got was really good, so we did what we intended. And the project also helped us connect research to real-world social work practice.
Okay, so we came up with several applications for our future practice in the social work realm. We think we need to make having advanced care planning conversations earlier in care a priority rather than waiting until there is a crisis. We also want to normalize conversations about illness and end-of-life care, even though these conversations can be really uncomfortable. But the more we normalize having conversations, the less uncomfortable and weird they're going to be, and the better we can serve our patients and clients going through these challenging discussions.
We also will commit to commit to a client-centered, strength-based approach in every advanced care planning conversation we have, and we'll ensure that we focus on what matters to the person and honor their voice throughout the process. We'll also practice cultural humility by recognizing that beliefs around death, dying, and medical decision-making vary across cultures and backgrounds.
Lastly, we will make sure we will meet our clients and patients where they are, whether they're ready to have the conversation or not. It's our role to follow their lead and provide them support along the way.
So what did we learn about putting together the project? This is something that might be relevant to people going to present next year. First of all, don't hold your event on a Monday. Mondays are apparently the slowest day on campus, so no one is here, and they're much less likely to drop into your presentation if they're not already here on campus. So don't have it on Monday. Don't hold your presentation on the week of lead day, which is the Harrisburg day, when people have to be on campus at 4:30 the next morning. Don't do that. Also, this is something to be aware of for future presentations, and I know Professor Mulvaney is going to provide some guidance on this as well, is digital accessibility concerns and some PowerPoint logistic, split screen, all of those kind of things, making sure people can read, making sure screen readers can read. We learned some more about that. Y'all are going to learn some more about that. So that's useful for the future. And finally, something is going to go wrong. Either your tech will not work, or no one will respond to your surveys, or people will not show up to your event, and it's fine. It's fine. What you did matters. It worked, and it's okay.
Asks, given your time in the School of Social Work, how important this is beyond gerontology related courses, where might you locate this content in the curriculum?
So that was a very good question. We are the first group of combining the gerontology certificate and the healthcare certificate. I think this material would go really well with the healthcare classes that we already have. I think it would be great for the first human behavior class, the generalist class. I mean, we talked about the earlier you have these conversations, the easier they are. So I think incorporating this information, especially as we're caring for folks across the lifespan. This is not an end of life necessarily conversation. This is for emergencies. This is for your whole life. So I think it could very easily be incorporated throughout the coursework.
Wonderful. And then we have a hand raised. Walid?
Hi, my name is Walid. Yeah, well, first I want to say I love the former name of your project, because it's a conversation I've been having with my mom recently, actually. Although initiated by her, interestingly enough. I knew very little. She was the one who was actually very much wanting to engage in that difficult conversation. And I personally still find it difficult because, nobody wants to think about the dying of their parent. Um, but I guess I'm curious if you could speak a little bit more about, you said, one of the things you learned was the challenges of having that difficult conversation. And it can go both ways, right? It can be difficult to initiate it with an elder parent. Uh, and vice versa. It can be difficult for a child to engage in that conversation. I'm curious what helped with having that conversation, and what did you learn in terms of approaching it uh, to make it more comfortable? And secondly, I'm curious if you have to also navigate a lot of like healthcare cost and healthcare system issues in part of that information you provide. Thank you.
Okay, that was many parts to one question, so I'll try and make sure I get most of it. So part of the inspiration for this is all of us have seen professionally, like I said, I'm in palliative care, Skylar's in hospice.
I'm just here.
Laura's just here. But we've seen where a patient is ready to discuss, typically, in palliative and hospice, I'm ready to be DNR. I'm ready to be, I don't want to keep doing this anymore. But their family says, no, absolutely not. You're going to be a full code. We're giving you CPR. We're intubating you. They're not ready to face this conversation about their loved one's mortality. And so in palliative care, what we typically experience is going in very softly, maybe offering a document like a POST or like the advanced care planning document and just letting them look over it. Just going in very gently, floating the idea and letting them sort of go at their pace for engaging these really challenging sort of questions. And then also, the social work role is to be able to sit and take time. A doctor might be in the room, checking on your organs, checking on your vitals, getting out. And what we can do is spend time with the person, really hearing what their concerns are, digging into the fear of mortality, and engage with those concerns on like an emotionally sensitive and empathetically accurate, culturally and spiritually sensitive plane, to really help people move through some of the fear in a way that like people in other disciplines can't or don't know how to do. So
we also took a lot of inspiration from the Conversation Project, which is an organization about having these conversations. And one thing they really emphasize is thinking about your values and thinking about what a good life looks for you, what a good end looks for you. So clarifying those values is it's a good, easy way to smooth into what do I want my death to look like? What does a good day look like? I lost my train of thought. When do I decide when my good days have come to an end? You know what I mean? Like, when am I too sick now? And what do I want that to look like? And I think on the healthcare system sides of things, I think doctors want you to they want to know. Doctors want to know what you want. They want to help you have the good death that you see for yourself. So I personally can't think of systematic barriers to this sort of work, because I think overall folks in hospice and healthcare and palliative care are interested in making these conversations easier, interested in preserving the client's right to their level of care. Also, one thing that's great about the state of Pennsylvania is I don't believe you need your living will to be notarized. So you can just have it written down, like just have the conversations, and that can go a long way.
So we also through those papers and like documents you made, they're awesome. Oh my goodness. So my question was, when you were developing them, what was the audience that you had in mind for like when choosing the vocabulary you use and like the so like who were you thinking of when you were writing these?
If I'm perfectly honest, so much of what I did here is informed by my field placement. So I'm thinking of families. I'm thinking of families of patients. Typically, for me, in the palliative care realm, are people who are in the hospital, who are if they're in the hospital, something is going wrong. This is already a real stressful time, who need it broken down for them in a way that is comprehensible and accessible, and in a document form where they can like pull it back up and look at it. You know, you don't have to remember everything. When you're in the hospital, you're being inundated with information and you're not well. Things are not going great. So my sort of the driving factor for the design for me was just making it easier for people who are in that situation. Anybody else?
Yeah, I was just going to say, to add to that, just thinking about the patients and the families, but really empowering the patients to have those conversations with the families, like by providing the conversation starters, because sometimes it is hard to know where to even start with that. So again, just kind of thinking of the patients and clients and families.
So thank you so much. I feel like this is such a really, really interesting presentation. I don't know if this is a question or a comment, but I'm really struck by how you shared, the 40-year-olds who attended, because I think what we are saying is, it's never actually too early to be thinking about this for any of us. And so I'm curious with the intergenerational group, what your thoughts are hearing about this and, knowing the humanity that's behind all those gatherings, and would it be a powerful opportunity for, elderly individuals to hear how complicated this is for younger, generations to be discussing too, but at the same time, how important this is for us as a society to be having these conversations. Again?
Yeah, for us, I mean, this is the Gerontology Fellowship. We're featured gerontologists, but for us, it was also very important to make sure that this information was accessible for folks our own age, because it's an emergency. It's care for an emergency, and that can happen to anyone at any time.
Any last questions, either online or in the room? Yeah.
This is less of a question and more a huge compliment. I feel, as I was saying, I'm sitting here, it really feels like you all are really advanced practitioners. I could see you and would want you to be in front of clients. And there's a way that, I think as a program director, it just made my heart beat to think, wow, you're incredible in the way, the gentleness, but the expertise. And so being able to hold both at the same time is a real skill. And the fact that families get to interact with you is a huge privilege. So I just want to thank you for the thoughtfulness and the empathy and also the skill. Like there's a real skill to what you all are doing. So kudos to you.
So our topic is advanced care planning, not dissimilar from what you just heard about, and really a focus on how to approach the hard conversations that we just talked about. So what our team decided to do was really create this document that's in front of you. And I think it's quite kind of complementary to the previous presentation that you just heard about as well. We all, as you've heard, oh, sorry, I didn't say my placement. My placement is at the Southwestern PA Partnership for Aging. We all have placements that are relevant to this topic, or we have a personal interest in it. And so when we were looking at the proposed topics, this was one that all of us thought would be something that we could really make like a big and lasting impact on. And so we decided to approach it as kind of an evergreen document rather than a presentation, just because this is something that, as the other group spoke to well, it's hard to do in one conversation, right? Or like it's hard to do at one time. And so the thought behind the document that we created was really, if we can make something that everyone can take home with them or refer to again, it can be used to kind of help you throughout the conversation, no matter how many times you might have it or how long this might last. So it's two-sided. You can see, sorry, it's hard. I guess I could pick this up instead of leaning terribly over the street. You can see that in the first page, we really kind of wanted to do an overview for beginners. So maybe you've never thought about having this conversation before, or maybe the person that you're talking to has never thought about this before, and you just kind of wanted some brief details about really what we're talking about and what it is. That's the first page. You'll also see the QR code leads you to additional definitions because there is kind of a lot of jargon in this topic area, like things that people don't necessarily know what are whole fits, right? Or even what ACP is. And so our goal was really making sure that that was accessible to folks who use it. And then just kind of some broader ideas about what to consider, including the fact that like this is probably a multi-part conversation and not just something that's going to happen in one 15-minute conversation with your parents, as nice as that might be. And then on the back, you'll see some talking points and some questions to really think through, as well as resources, noting some of the same that the previous group used as well, including the conversation project.
So kind of define ACP a bit. This is also something that you can find under scanning the QR code in the human definition section. But it's a process for individuals to think about, discuss, and document their preferences for future medical care in case they become unable to make decisions. So I wanted to say that we have 3 important life-sustaining biological systems: digestive, cardiovascular, and respiratory. With our digestive, is responsible for ensuring the body is nourished and that we remain hydrated. Cardiovascular is responsible for our heart beating. It keeps blood pumping through our bodies. Respiratory, the breathing system, moving carbon dioxide from the body and inhaling oxygen. And these systems work together to keep us alive. And so what happens when one or more of these systems shift in functioning, and your capacity shifts, and how comfortable do you feel thinking about this? Discussing this with a loved one is a challenging conversation. And so we wanted to, as our colleague Hannah said, kind of create a conversation that considers how challenging this is for individuals who have never encountered this before. So first, we consulted with Professor Mulvaney. This was about an hour-long presentation providing some of the basics of advanced care planning. Professor opened up the floor at the end so the cohort could inquire about more complex instances with advanced care planning, like the legal complexities of appointing a power of attorney and the differences between a power of attorney over legal or financial decisions versus a power of attorney over medical decisions and care. Our next step was consulting with a palliative care social worker at Camille's Placements. This conversation lasted approximately 45 minutes. We brainstormed our initial ideas. We were very, very ambitious with this project. And luckily we had folks to kind of help us narrow things down. And we received feedback about the most important elements. We found that most people are unaware of this type of care, specifically palliative care, and the conversations about palliative care until it's offered directly. So when you're in that crisis mode. In this meeting, we acquired our beautiful resources on the ACP 2-pager, and we utilized them in our literature reviews. Which leads to our next step. We had literature review. Along with the documents suggested by social workers and faculty, we had found additional literature. We pulled those key elements and synthesized the information in a way that made the information easier to disseminate to our target audience, which we students and families within the community who may be unfamiliar or uncomfortable with not only this type of care, but discussions about end of life or preparing for end of life decisions and capacity assessing. To solidify the flow of conversation, we watched market reviews of palliative care, social workers, medical professionals, and family interviews, and we researched how these conversations can operate in different cultures. We wanted to focus on making the language focus on the population that we were targeting, one of the ways we did that was taking out some of the medical terms, but we wanted to make sure we kind of created a gap, bridged a gap between taking out those medical terms and keeping in those formal definitions so that when our audience encounters these conversations, oh, this is from the ACP 2-pager definition list. I remember this medical term, and they can they have 2 different perspectives to fully comprehend what they're being told in a medical setting.
So this is kind of going to be a review of what the other group said, basically, because we learned pretty much the same things. But first off, advanced care planning brings up really complicated feelings and topics that can be accessible or unapproachable for many people and communities. For example, if you're not in the medical field, you may not know what a power of attorney is or what that process looks like. And the conversation is different for every person. It requires patience and empathy, and it's shaped by the relationship between the individual speaking as well as previous experiences with health and aging. And there's no right moment or single approach. Some people are ready to engage right away, while others need more time and reflection and repeated conversations before they feel comfortable. We also found that using the yes or no questions can create a barrier to meaningful conversations and honest answers. So using open-ended questions is the better approach. It gives time for reflection and consideration for the more complicated feelings and emotions that you might be having. And it helps build rapport as well, of course. I think we all know that as social work students. Many documents that we have provided in our resources can also aid the initiator of these conversations as well. It provides prompts and ways to really engage with the individuals and reflect on the things that are really important. For example, the 5 wishes document, which was actually, I think, the first advanced care planning document that addresses personal and emotional and spiritual wishes in addition to medical treatment, functions as a roadmap for how you want to be cared for by providing prompts. And it's actually valid in all 50 states, if you guys didn't know that, as an advanced care directive document. The success factors, I don't think, are very surprising. We want people to feel heard, understood, and comfortable and motivated. People are more likely to engage when they feel these things, and it creates more motivation for the continuation of these conversations. And it creates a more supportive and respectful environment, which makes a really big difference in the quality of the discussions. Finally, I thought this quote really stood out to us. Those who have these conversations are almost 3 times as likely to have their end-of-life wishes both known and followed, and their family members demonstrate less anxiety and stress and depression during bereavement. So starting the conversation is hard, but so is feeling regret after the fact if you did not have that conversation. Overall, this is not just about planning for the future. It's about communication, understanding, and ensuring that a person's values and wishes are respected.
Okay, so I'm going to talk a little bit about National Healthcare Decisions Day, which is our motivation behind this project. It takes place annually on April 16th, so it's coming up. And Paris is going to talk a little bit about our initiatives for the day after I speak. But it's aimed at educating and empowering the public on the importance of advanced care planning. So it started out as Virginia Advanced Directives Day in 2006 by Nathan Kotkamp, and it grew into this nationwide movement starting in 2008. And in the first 3 years, over 1 million healthcare providers received education on this, and over 14,000 advanced directives were completed. So what is an advanced directive? It involves naming a healthcare policy, or as our sheet says, a power of attorney, as well as creating a living will, which the National Hospice and Palliative Care Organization website has some great tools for that, if you're interested. So what is the motivation behind this event and what's its importance? So the event was actually, or the date of the event was actually inspired by a quote from Ben Franklin, which was, in this world, nothing is certain but death and taxes. So tax day is April 15th, so a great way to remember National Healthcare Decisions Day. It's the day after. So one day you renew your taxes, the next day you renew your healthcare decisions. Why is this event important? We want to know our loved ones' wishes. Ethics committees exist in hospitals to make decisions for people who don't have someone to make that decision there for them or can't make the decision themselves. So when you are mentally able, you want to be able to exercise your right to self-determination. It's also important because in some states, only spouses and blood relatives are recognized as people able to make decisions. So if you have someone who's not blood related to you, having them down as a formal power of attorney is important. And as the other groups have kind of discussed, it's an important conversation for people of all ages, because you never know when we're gonna go. Hold on one second. Here's our next slide. It's about the Conversation Project, which is a website that we referenced. It's in our resources on the second or the other page of our guide. And I have animations. Okay, perfect. So this is a reference guide that they have on their website, very similar to the one that we've created, but for a different audience. Ours is targeted more towards caregivers and professionals in the workforce like us, social workers. This is more for patient themselves. So you can't see it very well, but if you go onto their website, you can see it. It's the guide called Conversation Starter Guide. And it just goes through different steps. Think about what matters to you, plan your talk. Then starting the talk and keep talking. So it really just walks the person through making these kinds of decisions. It's a digestible way for people to think about their healthcare. And like I said, this particular guide is for patients. Ours is for caregivers, but they have tons of free guides, so I would recommend checking out their website. They have ones for choosing a healthcare proxy, being a healthcare proxy, talking to a healthcare team, caregivers with children with serious illnesses, and also caregivers of people with Alzheimer's and dementia. So it's one of great resources there, and like I said, it's linked on the guide.
Right, so that's a lot of information. But what's next after today, after you guys hear all this information, you have this flyer in front of you. So I'm going to share it with the community. We want this resource to be used beyond just today and this presentation. So it will live on our Hartford Fellowship website. So feel free to use it, bring it to your practicums, to colleagues, to classes, and your cohorts. As Caitlin mentioned, with National Healthcare Decision Day, that being a leading initiative for us trying to share this, especially with our school. So it'll be distributed through our social work students with the weekly e-blast. Like I said, it'll live on the Hartford website as well as be displayed throughout the school. If you need a reminder on April 16th, hopefully you'll see it there. But beyond just our school, we want to take it into the practice and into the workforce. So sharing it at our placements. 3 of us are at Community Life. So we've shared this with our dementia coordinator, who actually works with caregivers and runs a caregiver support group. So giving this resource to them, navigating those conversations, and we consulted with the palliative care social worker Community Life. So trying to take this into our practicum where we are working with older adults every day, as well as their families, and navigating those conversations. We recently just shared this with the whole BASW senior class as well. When talking with them, throughout the whole year, we're always talking about how you're always going to work with the aging population at one point or another, whether your practicum is with that population right now, at one point or another, even with their families, things like that, this will apply. But even with the other group said, as we said here too, this conversation is not just limited to that population. So trying to get that resource to all of our students in that class, as well as encouraging them to take it to their practicums and the people that they're working with there. And I know Cam's sharing it at Canterbury Place too. So trying to get out as much as possible. And Hannah will be sharing it with the MSW professors prior to National Healthcare Decisions Day to encourage that education on that day and encourage our fellow students and colleagues to have those conversations on National Healthcare Decisions Day. All right. Does anyone have, again, there's already some questions. Perfect.
Hi, thank you for the presentation, and also kind of related to the previous group as well. While I was listening to this, I was thinking about my community, Asian American immigrant community, and different cultural beliefs and values shape the willingness or preference or communication styles of people within the conversation. Can you talk about the literature or your experience around that, and like for me to start a conversation in my church with older adults, what would be the recommendation, like you have if I'm speaking to people who have different beliefs, or cultural, values?
I was just gonna say that we talked about this a little bit when yeah, the poll is in the way. We talked about this a little bit when we talked with, and I'm blanking on her name. Donna, the palliative care social worker, about just how these conversations should be approached differently with different communities. And I feel like the biggest takeaway that I had from that was like, how do you start the conversation with a trusted community leader or community member, and then kind of follow their lead in terms of what it looks like to bring that conversation to the broader community. Because she had talked to us a little bit about how I think she had spent time in some different community settings in Pittsburgh and realized that, like, kind of as you're saying, if you just walk in and say, let's talk about this today, people aren't necessarily going to be receptive and have a bunch of different considerations. And so I think really finding a community leader that's trusted, that can get on the same page as you and then help guide that conversation is probably a good way to start.
Just like wondering what your thoughts were about considerations, kind of like broaching that conversation with younger people, like people our age, like, because I think like a lot of the thing we get is like, oh, my parents are getting older, right? But it's like y'all said a couple times, like stuff just like happens, like.
I feel like a great way to approach starting having this conversation, especially with young people, is that if you don't make the decisions for yourself now when you're able, someone's going to make them for you in the future. So kind of like I said earlier, exercising your right to self-determination, your right to, having your wishes honored, like just kind of emphasizing that point that like, if you don't make your decisions now, like I said, someone could be the one making those decisions in the future that you might not agree with. And ethics committees in hospitals are great. It's great that they exist, but it might not be, what you have wanted, or like you're saying with communities. I know I had mentioned how blood relatives are often the default. So, with communities with who have partners who aren't who they're not necessarily like legally married to and stuff, just emphasizing the importance of like someone else can make this decision if not you. So like that's why it's important to be filling out these documents right now.
And I think it's also important to know that this is something you can continue to update. Even if relationships change, you can continue to change the document, and if you need to get it notarized and all that, it's a process, but it's something that's important because you're, like she said, like self-determination should be valued and it should be legally like standing. So, and that's something that Dr. Mulvaney actually talked to us about.
So thank you to all of the groups. We did record this today because we have some supporters, and I want to thank a few of the supporters of the HPPAE who gave to us on Good Day of Giving. And we're so grateful, and some of them couldn't be here and they asked if we could record this, and we'll be sharing these projects with them. So we're very excited for that. We're also really appreciative of the help of the faculty and staff, and we do want these documents and these projects to have legs. And that means we encourage you to share with people at your practicums, but also people in other spaces in your life.